When your child has to have surgery or any other type of procedure, like an MRI, we know that it can be a stressful time for you and your family. Arkansas Children's is here and ready to see you now. We know your child's health is a big deal, and so is their comfort level, which is why we are so excited about pediatric sedation at Arkansas Children's Hospital. The pediatric sedation designation is currently held by 10 children's hospitals nationwide for meeting or exceeding the highest quality standards of the Society for Pediatric Sedation. We are lucky to have such a great sedation team for the kids of Arkansas and beyond. They provide safe, effective care for about 100 patients per month. Today on the Live, Learn, and Play podcast, we sit down with a member of the team, Dana Thomas, to discuss this family-centered medical approach to keeping your kiddo safe and relaxed during a stressful time. Please rate and review the Live, Learn, and Play podcast wherever you listen to your podcasts, and please subscribe. Now, here's Dana. Welcome back to the Live, Learn, and Play podcast. I'm Rebecca Brockman, and this afternoon I'm joined by Dana Thomas. She is a RN3 CPN for our Pediatric Sedation Team here at Arkansas Children's. The Arkansas Children's Hospital Pediatric Sedation Unit was recently designated a Center of Excellence in Pediatric Sedation by the Society for Pediatric Sedation. This designation is currently held by only 10 children's hospitals nationwide for meeting or exceeding the highest quality standard of the Society for Pediatric Sedation. So today we are going to talk about how pediatric sedation is helping patients and families at Arkansas Children's, and Dana is our expert this afternoon. But before we dive into that, Dana, and what this means for patients here, if you could just tell us a little bit about yourself. We started talking before recording, and I found out you've been here quite a while. But what brought you to Arkansas Children's, and talk about more about your experience here.
Okay. Well, yes, I have been at Children's for 25 years. I actually have been a nurse for longer than that, but I have always been geared toward kids. I love kids. I act like a child myself. And so I just can't imagine working any other place but Children's Hospital.
So pediatric sedation, when you're not on the clinical side, I'm not. I'm on the marketing team here. So when you hear those words, we're familiar with the word sedation and that it relaxes you and helps you through a situation. Talk about maybe how long Arkansas Children's has been doing this and why it's different or it's getting the recognition now.
Well, we actually we have had a sedation team for quite some time. I believe it actually started back in 2002, 2003. But just of late, probably in the last 3 years, we've really tried to develop the sedation team, and we've started working in different units and really tried to be involved with different departments and encouraging them to use sedation to save kids from having to go to the OR for procedures that don't necessarily need to go to the operating room.
So the sedation, using that method, sounds different than maybe what parents are familiar with anesthesia. How is this process different for the family and for the patient?
Well, anesthesia, for the most part, they can sedate anyone, obviously, because anesthesia usually will use something to protect a child's airway when they're in the operating room. Sedation team doesn't use an artificial airway, or there's no breathing tube per se that goes down a child's throat. So we sedate kiddos that are generally healthy for the most part, that don't need that extra step. They don't need the breathing tube. They don't need to go to the operating room for any length of time for something that can be done easily in our procedure room or in another area of the hospital.
And could you give us some examples of procedures where the sedation would be a good method?
Sure. We do a lot of procedures in the hematology oncology unit, like lumbar punctures, bone marrow aspirates, We sometimes do procedures like taking pins out or setting a bone for orthopedics. We do a lot of scans, MRIs, CTs, MIBG scans for kiddos that have neuroblastoma. We do Botox injections for our kids that have CP. We do hearing exams for kiddos that just cannot be still in a booth, or they have questions about the actual what sense of loss they actually have in hearing. We do a lot of things in a lot of different places.
I got some stats before we started, and this pediatric sedation is used on about 100 patients per month?
Correct.
Okay. So take us through maybe a patient who is getting an MRI before the visit, during the visit, if they were a good candidate for pediatric sedation. What would that look like?
So about 3 days before your child is scheduled for an MRI, they would get a phone call to go over their history. Are there any problems? Have they been sedated in the past? Were there any issues with that? Any kind of medical history they might have. And then, of course, we ask if there's anything we can do to help the visit. But in that time frame between when they get the phone call and when the kiddos come to the hospital for the procedure, I find it's really helpful if they if it's for an MRI, say maybe go watch an MRI on YouTube to kind of get an idea of what it's going to look like. But also, even if you can't do that, when they get here, we have something called Child Life that's very good about even showing you videos of things and kind of walking you through the process as well. But also, it's really important, I think, to bring something that gives your child comfort, like a blanket or a toy, something to distract them when they are getting ready for the procedure, if they have to have an IV start, which I'd like to mention for IVs. I know a lot of parents and kids have anxiety about that. And we do have things, we have numbing cream that, of course, they don't give adults, that kind of thing. But at Children's Hospital, we don't like kids to have pain. So we use numbing cream that has lidocaine, so it's numbing and they can't really feel it. But the main thing that we find is helpful is distraction. So if they have a video they can watch or a movie or music or something they can do while we're actually doing that to keep them from watching it, that helps so much with their anxiety level. And also if parents, kiddos look to their parents in terms of if they're upset, kids tend to be a little bit upset too. So come in calm, expect we're all on the same team. We all want to get this done together because we want it to end well for everybody.
Dana, I like that you mentioned about having your child go online and watch a video. On our YouTube channel, Arkansas Children's, we actually have an MRI, what to expect video. So that would be really helpful for patients and families to watch ahead of time. So along those lines, how do you describe what pediatric sedation is to a patient? Let's say they're 4 or 5 years old. What do you say to them?
If I were going to describe sedation to a child, I think what I would say is, we're about to take a little nap. We actually refer a lot to magic milk. The medication we use most of the time is white and looks like milk, and we call it our magic milk, and it comes from magic cows. Sometimes it can be seen flying around the hospital. You have to really look for them. But that they just are going to go to sleep for a few minutes and then they'll be awake and they can eat. So if we can distract them by thinking about what they're going to eat when they wake up, they're usually pretty happy with that.
I like the magic milk and magic cow story. That is excellent for children, especially if they're a little nervous about whatever procedure they're going to have done. If you could also talk about the recovery, you just said 15 minutes. So I think for parents who hear that, compared to if they're waking up from a regular surgery, from anesthesia, what is the recovery time and process like compared to that?
The recovery process is usually pretty simple. We try and give the least amount of medications as possible, so they tend to wake up very well. For the most part, if they go to sleep happy, and even sometimes if they don't, they tend to wake up pretty happy. And so usually the medicine that we give wears off in about 15 minutes. So as they start to wake up, they are more and more alert and are able to eat and drink as soon as their eyes are open, and parents can be there when they're waking up, and that's obviously very helpful for the kiddos. And as soon as they're eating and drinking, they are pretty much out the door. And we give them a list of discharge instructions and numbers if they have any concerns. We tell them what medications they had so they can share that with their PCP if they want to. But for the most part, it's a pretty simple, easy process.
So Dana, we've talked about the perspective from the parent, but for the child, for the patient who is going through this, how do they actually feel when they wake up from the sedation? Are they groggy? Do they feel like they just woke up from a nap?
Well, it differs with each child, but for the most part, I would say most of them are hungry, but a little bit dizzy. They might be a little bit dizzy, a little bit top heavy for a few minutes, but as they start stirring, and some of them just pop right up. But for the most part, what we've seen is our kids that we see over and over again that are routine patients, they really get excited when they see me or see one of my teammates because they're going to get magic milk, which means they're getting a nice little nap and they enjoy it. It's not scary. They just know they're going to be rested. And a lot of people have said, it's like taking an 8-hour nap. They just feel comforted and rested again, and then they wake up and they eat. So, isn't that what everybody wants to do?
That sounds good to know, that the perspective from the patient as well. Going back, you said that Arkansas Children's has been doing this 3 or so years. Why was it important for them to go through the accreditation process?
We really wanted to show that we are a great team, and that we have it down to I'd like to think of it as a system, like we have it down to a fine-tuned system. It was a lot of work, especially Dr. Dalby put in a lot of hours and many, 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 many pages of filling out forms and dotting our I's and crossing our T's. But we are compassionate, and it was important to us to say that we can do what the big dogs do, like the other areas, the other hospitals that have the same thing, that we're doing the same thing here and can provide that here in Arkansas.
Right. And as I said earlier, this designation is currently held by just 10 children's hospitals, and that's nationwide, for meeting or exceeding the highest quality standard of the Society for Pediatric Sedation. So that is kudos to you, Dr. Dalby, and your team. In closing, we've talked about how this helps the patients and the families, but I think if you could just kind of reiterate and touch on how this does help patients and families at Arkansas Children's compared to if they went somewhere else for care. Why is it different here?
I think it's different because we are trying to be a family-centered approach. I think in Children's is it's one of the very few places I feel like you can get that. Obviously, it's different from an adult hospital, but even down to the numbing creams and the songs that we sing. I was listening to a patient that was being induced recently for a sedation, and it's not very often you can go in a room and see a big burly man singing, Wheels on the Bus. We just gather around and treat the child like our own, and I think we really try to make it as comfortable and as peaceful as it can be for the whole family. We know we've had kids as well, and we know it's stressful anytime your child has to have a procedure or go to sleep, and we try and put that foremost in our minds. What would it feel like for me? What would I want to have for my child? And take it very seriously and make it a timely thing, so it's not drawn out and it's not taking all day, but kind of refine it to a short time and a pleasant time. And we talk about family a lot, making the kids part of our family too. So we want everybody to have a good experience.
So Dana, based on what you have shared today, you can definitely tell that you are passionate and have compassion for these patients and families. You have been a champion for children here for 25 years. What brings you to work every day?
Well, honestly, I love kids. I love the thought of singing with kids, and not only that, but I have a great staff that I work with. They make it fun. They are as much of part of my family as my own family. We don't just text at work. We text on the weekend. And everyone at Children's, honestly, is the same. They're all family. They all get along. We all work together. We all have the same goal. But just to make it, being a kid, a lot of things are scary and they don't make sense. And so we're trying to make it just as easy and as fun as we can make it. We want to have fun. We sing with the kids. We make up songs. We sing, all things Disney all the time. So we're just trying to make it fun for everybody. And I think that's what keeps me wanting to come back year after year and day after day. It's just a great place to be and to work.
Excellent. It is. That's family-centered care, and I think learning more about this pediatric sedation is going to be helpful for our families who are listening. Again, congratulations to Dr. Abdallah Dalby, of course, Dana Thomas, who's with us this afternoon, and the entire Pediatric Sedation Team for providing safe, effective care for approximately, and even more, 100 patients a month, each month through pediatric sedation. So thank you, Dana.
Thank you.
Thank you again to Dana for coming by and telling us all about the great work the Pediatric Sedation Team is doing and how impactful it is for kids and families. Here at Arkansas Children's, we know that one size definitely doesn't fit all when it comes to your child, which is why the sedation team is so dedicated to providing right-sized care in a safe and compassionate way. If you have any more questions about pediatric sedation or the team, ask your Arkansas Children's Hospital pediatrician or visit our Facebook page. We recently had Dana on for a Facebook Live interview, and she can answer more of your questions there. Thanks for listening to the Live, Learn, and Play podcast. We know times are tough, but we hope your family is doing well, you're washing your hands, you're wearing your masks, and you're staying safe. Again, please do not delay care. Arkansas Children's is ready to see you now.